Hi, y'all. How y'all doing today? I hope all is well and I hope you've had a great week like we have. I'm just happy that we are here today talking to you about levels of care of healthcare. So today I'm just going to just jump on in and just talk to you about it. I don't have a slide presentation because, like I said, that's not my gift. I'm just the gabber, and I like to talk. So what I'm going to do is I'm going to talk about levels of care. Okay, so we are in a time in our lives where everyone is living longer in most cases. So you're living longer, you're having to navigate with your insurance companies and making sure that you get the levels of care that you need, and they want to also make sure that you people are not being wasteful with your benefits too. So I wanted to get on, and I think today is going to be good for caregivers, and it's also going to be good for us who have the health warriors, because each day we are finding out there are new benefits and new loopholes and good and bad ways to affect the healthcare system. And I'm sorry to say it, someone explained it in a mixer that I went to earlier today, and she said healthcare in America is gross. So I really thought that that was kind of funny, sad, but honest. Um, but we have what we have, and we are in some. You okay? In some
Yeah.
we do have some type of actual healthcare coverage here, so we're not here to be talking about what's good, what's bad, and the ugly. It was just a cute little joke that she told. Okay, so everybody knows about when you get sick, you go to the hospital and you go to the emergency room and you say you're in pain, okay? Or something's happened to you. These days and times, you don't necessarily have to be admitted to the hospital just because you go. And even though you may not be in a situation where you can um, go home, but you need the care, you can actually be discharged from the emergency room to other places. So I don't know if you all aware of that. So just I want to put that disclaimer out just in case someone comes up to you and your loved one when you're in ER. You have an expectation that your family member is going to be admitted to the hospital, and they say no. Just know that they're not trying to get over, mistreat your loved one. It's just in these days of managed care and just nursing staffing shortages, life be life, and even in the hospital systems, you can go other places. So I just want to put that out there. So, hospitals, you have typically the ER connected to it, you have the laboratories in it, you have all the testing that can be done, which is why most of the time when you call your doctor and they say if you are having issues, go to the emergency room. Okay, they say that because they say they can't do the doctor said they can't do the testing in their actual office. But then there is also a problem sometimes because you have to wait too long to have to be seen. So now let's move on down. Okay, I went into the hospital and I had surgery, and now I've had surgery, and I've had surgery 3 days ago. Okay, and the doctor's coming in and saying that I am getting ready to get discharged. And I think the doctor's lost his mind because I just had surgery 3 days ago. But in these days with the actual healthcare system. You can um, actually go to other places. So we want to talk about those places. And I'm sorry if I'm talking in circles. Okay. So the first place that you can go to, which is the next level of care down from a hospital, is typically a long-term acute care hospital. Okay. Um, the abbreviation for it is LTAC, LTAC. Uh, these type hospitals are for people who may need to be in the hospital for extended period of time, maybe 2 weeks to 6 weeks. It just really depends on what's going on. And this is determined by what's going on. If they need to have, let's say, the IV medications that they can't have in the home, they go there until the medication is completed, and it's cheaper than staying in the actual hospital. They can, but you can, if you're there in a long-term acute care hospital, you can also receive physical therapy, occupational therapy, speech therapy, just like you, let's say you did it at your actual, in your hospital room. Okay. Because LTAC is indeed a hospital. It's just a lower level of care. So,
Can I
um,
ask a question, Keisha, for maybe the people like me who don't understand? Could
sure.
you tell me the difference in that and a rehab? Because when you're saying that, I'm thinking of wow, I've never heard of that. I would have thought just go to a rehab.
All right. I'm going to get there, though, I promise. But yes, there is,
Okay.
I'll just go and jump on, well, I'll just jump to it now. Um, the difference between an LTAC and a rehab hospital typically is that you go to a rehab hospital to recover something, be it knees, your hips, all that. Yes, you can have IV medication there, but the difference between typically a long term acute care hospital and a rehab hospital is that the rehab hospital, you receive 3 hours of rehab. That's the main thing. They want to get you as close to 3 hours of rehab as they possibly can. They use goals. Um, I can't think of the name right now, but they have these goals that they set for the patients and say, okay, if, like in my case, when I went in, I had a lot of weakness. So they would monitor how I would do, and they would force me to get up and work 3 hours. It may not be 3 hours all at one time. Sometimes people have to rest in between. But the main thing with the rehab hospital is the 3 hours of care, and for the rehab side. So it's where you go when you're less medically challenged or
Hmm.
complex, and you're just ready to start working on your recovery as far as getting stronger. So that's the difference between the rehab and the LTAC. So it's like, yeah,
Okay.
they're gonna work you hard there.
Okay.
Now, as we're talking about that, I'll go to a segue of what's a skilled nursing facility, or a SNF. Now, a lot of these, and I hope they don't get mad at me, but it's the truth. A lot of these facilities put Keisha's nursing and rehab. Okay, so if I put Keisha's nursing and rehab, I go in and I, in this situation that I'm discussing, where they'll say that, yeah, we offer you rehab too at our facility, and you can come to our facility for rehab. But there is a difference. What each person should try to do is make sure that they are asking the questions. Will I get 3 hours of actual rehab? Will I get in
Hmm.
rehab on the weekend? Because a lot of them do not have physical, any type of therapy on the weekend. So that's gonna be different from in an inpatient hospital, rehab hospital, where they'll actually be giving them that therapy all of the time. So you will get some rehab, but you won't get the three
Hmm.
hours of rehab. Like they do at the inpatient rehab hospitals. So, but the main thing is you want to challenge your discharge planners and make sure that they're not trying to get you to agree to something that is not inpatient rehab. Okay. Now, if they're just being honest, in some areas, there are not any inpatient rehab hospitals available. And in that situation, then the skilled nursing will possibly be the next level. Or sometimes they'll keep the actual patients in the hospital and in the inpatient hospital and give them more therapy to try to get them stronger before they go. But they have to have a reason to be in the hospital besides just inpatient rehab, as far as being in Keisha's medical center. Okay. So that is the big thing, is making sure that you just know the difference. Now, skilled nursing, you can get like 90 days worth of approval, and some of them are co-insurance, and we're not going to get into all of that. But yes, you may be able to stay there a longer time, but you won't get the intense rehab that most people get in the inpatient rehab side. Now, when it's time to transition to your house, then you come up with different things. Or if you're a caregiver for your um, family member and it's time to transition home, they could actually have home health come and care for them if they cannot um, go outside and function outside of the house. Is typically a guideline that is used. And you can actually have a nurse come and see you. You can have a the therapy department come and see you. I even had a therapeutic rec person who came um, to treat me, and she thought it was a good idea for me to have bad vision and maybe do some work with chain. I mean, with drill. But anyway, um, but you can have your actual therapy at home. Now, you probably won't get more than an hour in your home when when you have the home health there at your at your house. So you could work with the home health and your family to schedule different things, especially if you're the caregiver and you are dealing with burnout, like we talked about last week. You can schedule your care with the dog, with the dog, skip with the actual home health companies to try to help things be easier for you and your family member. Okay, so just know that you can schedule. Okay, nurse, can you come at this time? Or aide, can you come at this time? And maybe we can bathe mama and have mama ready for bed at night. If you come at this time. So home health isn't a good uh having a brain infarct. Home health is a good resource for you, but also moving even down from there is like personal care services. Now, with personal care services, this is typically something that's not covered by insurance. So this would be something that you would have to talk to your family about. It may have to be a pass the hat kind of situation among the family. um, but it can help. This could be where you have sitters come in during the day if you have to work and you don't want your family member to be in a facility, or just for a short period of time that your family member needs to have that extra care while you can work and school and take care of life. They can offer those services for you. Some of them help with bathing, but you just have to prepare that it's not going to be covered by insurance unless you have long-term care insurance. And from what I heard in from an insurance agent today. It's getting harder and harder to find insurance companies that are actually even covering and having the long term care insurance because of the fact why we're living longer. And insurance companies are in the business of making money.
Making
And
money.
yeah. And so when they're trying to make that money and we're living longer, it hurts their pockets. So if you have a long term like care insurance, please hold on to it. Don't let it go. It's like gold, platinum. Hold on to it because you there's a great chance you won't be able to get it again. And if you have a condition like well just anything pretty much, it may be hard to qualify to get it, but you surely want to get it before you will leave the 40s. Okay, your 40s, because you're more of a risk once you hit 50 as far as they're concerned. Are you more at risk the more conditions that you have? So if you get these jobs and they have XYZ insurance with ducks and swans or whatever they have, that's offering long-term care insurance, sign up and budget for it. Take your lunch to work because it is definitely worth that money that you're paying because it's going to be able to help you in the long run. Because some assisted livings, which I'm going to talk about next, they actually accept the long-term care insurance, and it may probably won't cover most of the assisted living costs, but at least it'll be something that will go towards your bill. So with dealing with people living longer and families living further and further apart, people are coming into these complex family dynamics because they have to figure out what to do with a family member who may be starting to need additional care, or maybe they're living in a house that needs additional work and upkeep and they're not able to do it. And sometimes that decision has to be made to sell the family home and go to a senior apartment, or well, let's start with the senior apartment. If they go to a senior apartment, they're going to have to downsize their lives, but it's something that sometimes has to happen. And some of these independent apartments are actually attached to assisted livings. So you can start there and say, okay, I don't want to have to care for my home, or my family is too far away and blah blah blah. You can stay an independent, and then when you get to a point where maybe you need just a little supervision, maybe somebody to remind you to take your medication at night, or just to make sure that when you taking showers and such, that there's some staff just in case you may be a fall risk. Then those are reasons that some people actually pick going to assisted livings, just because they'll have that just little bit of protection and know that someone will be there in the building to care for them. And you can even find some of these properties that will start off with independent living, then they will go to the actual assisted living, and then they can transition to the skilled nursing side when they need more around the clock care. Okay. But it's all going to be about what's best for you and your family. Know that that's something you need to check as far as like I said, with long-term insurance, long-term care insurance, to see if that will be covered. Also, even with some of these plans, for these replacement plans or advantage plans, you want to also put them side by side and see what you actually get the most. And you in my opinion, Keisha soapbox, going and being able to get $100 a month in groceries on a gift card versus being able to buy your medications, go to your doctors that are in there working, and you don't have to do long trips to go to different people and possibly risk um, subpar health um, care. I don't want to call it treatment, but if you're having to just possibly deal with a decrease in the quality of your health care, that $100 means nothing for that gift card. So make sure, if you all can, to have someone check behind you. Look at these benefits. This is what I have, and that way you'll know what you'll be able to have just in case you need it in the future. So that is my little spiel for today. I hope that it helped in some way. And I don't know if anyone have has any questions, and I hope I didn't talk too fast, and I also hope I didn't ramble. But my goal was to to help.
No, that was good information. Very good information. Only I'm just going to add on top of what Keisha's saying. As a community, making sure that you guys understand that there's no right or wrong facility. It's what's
Mm-mm.
best for you and your family. And from last week and the weeks before, when I said you guys have to have create that support system so you guys can make this decision together as a family. If there's like if it's a parent and you guys are siblings caring for and having to make that decision, just come together and know that you guys are doing what's best for your parent. And in this day and time, it takes a lot to care for an individual in your home. So if you're not able to do that, and the best placement is the acute or the SNF or
The SNF.
whatever it is,
Mhm.
the SNF. The so just make sure that you guys are making the best choice for your family
Absolutely.
as a whole, for the
Absolutely.
the healthcare warrior and for the caregivers, because it's all a lot for each individual. So there's no right or wrong, and whatever you guys decide as a family and what's best for your loved one, that's the best decision.
I totally agree. I totally agree. Because no one knows your situation, and you all have to do what's best for you. And what may work best in my house may not work well in your house. Because
Yeah.
that's just how it is. I may not have a job where I can be able to work remotely, So it truly is what's best for you, no guilt. Do what's best
It,
for
that
you, no
that
guilt.
right there, that guilt. And my thing is the mental capacity part of it, because what that's what a lot of people don't understand. They'll look at like, oh, you have the big house, you have the finances, but you may not have the mental ability to do
Mhm.
it, because it is very taxing. It comes with a lot of emotions, a lot of mental strain and stress. So you have to do what's best for you and that family member. So just make sure that you guys are putting everything on the table and making the best decision for the family.
I agree.
Great information, Keisha.
Well, thank you. I'm just glad. Look, I can be seen. Oh man! But everything we
Right.
do because we try to bring you out information that is helpful. So
Yes.
I hope this was helpful to you, and if it was confusing to you, put some questions in the comment section. We will answer them. And I promise you, if we don't know the answer, we will go and look it up and get back with you, or
Yes.
say, I tried to look it up and I couldn't find it. So let's keep looking together. Because we will
Absolutely.
try,
Absolutely.
truly try and help. Well,
Well, good night or good day, whatever time that you guys are watching it. We appreciate you taking the time to listen to the information that Keisha shared with you guys. And as she said, we hope it was very beneficial and helpful for you guys. Bye bye.
good night.